what we're seeing on the pediatric side of things is more admissions. And if you look nationally at the numbers, particularly between age 5 to 15, those age range patients used to be in the bottom 2 lines of growth of hospitalizations per 100,000 cases, but now it's consistently in the top number of hospitalizations per 100,000. Kids are more and more vulnerable to the Delta variant due to a number of different things, but our most susceptible age range are 0 to 4 years, and we're seeing those kids admitted to the hospital 10 times higher with this Delta variant compared to the previous COVID infection and winter wave of last year. At our facility, that graph that Dr. Robertson showed, if you want to break down numbers, if you look from June through August, and that's our assumption of Delta variant related admissions to COVID, you're going to see about a 6.5 time increase in hospitalizations. Now, just early on here in September, I don't have the numbers, but I would say those numbers are exponentially increasing in the same consistency that they have from early June to now. And a lot of that has to do with kids getting into school, and then the spread of the Delta variant is escalating. The Delta variant is much more transmissible. Of course, in pediatrics, we're taking care of kids for the large majority are not eligible to get the COVID vaccine. And so those who are 12 and older and are getting the vaccine, they're hospitalized at a rate 10 times less than those who are unvaccinated. And so we do see that the vaccine is aiding in those 12 to 17 eligible vaccination population to be effective and beneficial. And so it's just once again hearkening to the numbers that vaccination does decrease our risk of hospitalization as well as severe illness. What's sort of interesting is, if we look at some UK models and some other European country models of the Delta variant that hit sooner, they seem to peak about that 60-day range. Perhaps we're right there at that 60-day range of Delta variant here in Oklahoma. I'm not sure. I think the next week of numbers will kind of prove that right or wrong. But it is interesting to kind of be right there at that plateau and see how that affects the pediatric population and admissions, because what we know is that the vaccine can keep people out of the hospital. And what we know is that most of our population and pediatric populations cannot be vaccinated. So we'll see moving forward into September with more and more school days behind us if our numbers continue to escalate. And I really feel like they will. And so what I would like to hearken on is vaccination is important, and masking is a mitigation role that we can play for our children if we want to lower the risk of contracting the virus, because not every school has a mandate. Most schools don't have a mandate. Some private schools do, and some charter schools do, but most have no mandate to mask. But what that means is parents can still make an informed decision, look at the data themselves, ask their pediatricians or the physicians that they trust their kids to see, ask their opinion on the masking for their children. And I think what they'll find is all pediatricians in the Tulsa area and most family medicine physicians say, please mask your children going into the school year, because it is one thing that we can do for those unvaccinated kids. And please do, 12 and older, please vaccinate to protect the kids that cannot vaccinate yet. And so we'll see what happens in the next couple of weeks as school becomes more and more in swing.
For more information, you can visit tulsaworld.com.